So the things I'm going to talk about today, I'm going to say a little bit about the work that we do at Lucy Faithfull Foundation Scotland, just to give you a bit of context. I'm going to talk a little bit about this theory called situational crime prevention and how it might apply to prevention of child sexual abuse and harm to vulnerable adults. I'm going to say a bit about kind of what we know about kind of pathways into sexual offending. I'm going to examine some of the current research into prevention and then finish off by saying what this might mean for faith and belief communities, and then we can kind of take questions and have a bit more of a conversation about this. The team, Lucy Faithfull Foundation Scotland, focuses exclusively on the prevention of child sexual abuse. And in particular, we work with people who present a risk of harm to children, who cannot get statutory support for whatever reason. And then we take all the learning from that and we turn it into prevention resources and things that the general public can use, organisations can use, safeguarding colleagues can use. The team is made up of people who are social workers like myself, but half of the team are former law enforcement colleagues. We also have a full-time forensic psychologist. And also I'm really delighted my colleague Stuart Allardyce is with me here today, who's our prevention manager, who also used to head up sex offender treatment in social work in Edinburgh. We get referrals in particular from our Stop It Now helpline. And if you don't know about the Stop It Now helpline, I would suggest that you have a look online at what we do. The Stop It Now helpline, funded by the Home Office, it's a child sexual abuse prevention helpline. We don't use any volunteers. All of our helpline staff are child protection professionals. And we take calls from the general public and also professionals in relation to child sexual abuse prevention. Last year, we took just under 20,000 phone calls, emails. We also have a live chat function as well. So those kind of 20,000 or so contacts came from just under 9,000 individuals. So lots of people are reaching out. And who are those people? About half of those people are people who are worried about their sexual thoughts, feelings, or behaviors towards children. These may be individuals who have not offended yet, who are worried about offending. They may be individuals who have offended and already been arrested, but it's also an anonymous and confidential space. So some of the people who phone us actually are people who are involved with offending behavior and want to do something to move towards safer choices and moving away from offending. When you phone the helpline, you will hear somebody say to you, thanks for phoning, just to say something about confidentiality at the start. If you're at risk to yourself or other people, or you tell us about any criminality, we may need to pass that information on if we know who you are. But you can choose any name in this call, and we have no way of identifying you. So that's the anonymity that we provide here. About a third of the calls that we get are also from adults who want to be protective in a particular situation and want some advice and support about how they do that. It could be the mum who phones us, who says, actually, I'm really uncomfortable about the way that my uncle is playing with my 3-year-old daughter. There's lots of rough play, and he keeps on joking about her being his new girlfriend. And I want to know what to do about that. What kind of conversation could I have with him? How do I put a family safety plan in place? Kind of situation where harm hasn't happened yet, and if the person phones social work or they phone the police, it's likely they'll be told, well, actually nothing's happened yet, so there's nothing we can do. But actually there are lots of practical things that the mum can do in that particular situation. Let me illustrate this with an example, which is actually a phone call that I took in the office a while ago. Jack, I've kind of changed, some of the details to anonymize. He's an individual who phoned us up who said that he had 2 stepdaughters, one who was 14 and one who was 16. And over the last 9 months, he had noticed that he had had sexual thoughts and feelings towards his older stepdaughter. And he was very clear in the phone call that he wouldn't do anything about this. He didn't think he presented any risk towards contact abuse towards his daughter. So I said to him, if that's the case, then why are you phoning here? And he said, well, I've hit rock bottom because actually the other day I was online and I started looking for spy cameras. And I was thinking about putting a spy camera in the shower unit in the bathroom so I could film my daughter. We had to kind of reinforce the absolute illegality of that. But when we began to kind of unpack the context with him, actually the context for Jack was interesting. This is an individual who'd experienced really significant mental health issues over quite a period of time. Although I've not put it up here, he had a really significant issue around alcohol use. He was also very socially isolated, had isolated himself over the last few years, had a fairly dysfunctional relationship with his wife. Critically, he was on a daily basis looking at online pornography, in particular voyeuristic pornography. And you can see why that stuff around voyeurism and how that had then began to spill over into some of his fantasies that then began to be reflected with respect to his daughter. Now, in this particular situation, the important thing was to put an immediate safety plan in place. So let's look at what safety looks like in the context of that family. And we did some work about that, in particular looking at what some of the pinch points were. He would talk about how, for instance, his daughter would go for a shower, and sometimes he would hang around outside waiting for her to come out in a towel. Well, we need to kind of stop those kind of things immediately. But actually, the longer term plan with him is getting him to address some of the issues around pornography, alcohol use, his social alienation, his relationship with his partner. And indeed, we did this over a period of time through anonymous calls with him. What we're basically doing here is taking all the principles about sex offender treatment and trying to do them more upstream, trying to do them at a stage before people actually commit offences in the first place. We also get phone calls from faith and belief colleagues as well. Here are 3 examples of phone calls that have come in to our helpline over the last few months. They've all been lightly fictionalized, but A is a church leader, has heard about a new church congregation member with a criminal conviction dating back 10 years. This member has been attending church for a few weeks, and A wanted information about the legalities regarding disclosure. B is a safeguarding lead in a church, called after a 22-year-old female disclosed having a sexual attraction to children to him. She'd not disclosed any offending and does not want to act on the attraction. And then M is age 29, called the helpline for the first time in 2023, reported having been given the details of us by a previous church safeguarding leader, following him making confessions to his church about his sexual interest in teenage boys and voyeurism in public toilets. If there's one call for action here, in your work around safeguarding, have a think about how the Stop It Now helpline can add value to what you're doing. Other ways that you can promote the fact that there is an anonymous and confidential space for adults who want to better protect children, either those who present a risk of harm or those who are already protective but want to be more protective. Because I want to talk a little bit more about how we can stop child sexual abuse before it happens. I said that the work we do, we work with people who present a risk of harm, and then we try and turn that into initiatives that can prevent harm in the first place. An area we've done a lot of work in over the last few years is online harm, and in particular, the viewing of child sexual abuse material, what is sometimes called by the general public child pornography. And we have a massive problem in this area. You can see these statistics here, but the National Crime Agency in the UK suggests that up to 840,000 people present a risk of harm to children. But the vast majority of those are people who are looking at child sexual abuse material. And indeed, Childlight, based at Edinburgh University, the new data lab around child sexual abuse, has described online child sexual abuse as a global pandemic. Now, why is there such an increase in this particular area at the moment? I mean, some of it is about people's online behavior, but I think the important thing to hold on to here, the phone calls that we get at the helpline from individuals who are involved with looking at child sexual abuse material are generally not individuals who think about themselves as paedophilic, not individuals who have had thoughts and feelings for children throughout their lives. Some of them are, but the majority aren't. The majority are individuals who describe watching lots of legal adult pornography and over time becoming desensitized to that, over time looking for more extreme material. And in looking for extreme material, they find material that involves children, and then they find that they have a capacity to be sexually interested in that material along with lots of other kinds of material as well. So there's a trajectory that we're seeing, which is actually in relation to legal online pornography that we need to pay attention to here. And in fact, over here, we've just published a report kind of looking at kind of trajectories into online offending. Just to give you an example of that, I worked with an individual who was in his 50s looking at lots of legal pornography, often several times a day, and looking for more extreme material and eventually finding some material involving teenage girls. And he said that when he found that material, he didn't think about it as being any different from any of the other things that he looked at online. But he said, actually, he said, I never really thought about images of kids. But actually, when I closed the laptop, I found my heart was pounding faster than it ever had been. The reason being that at that point, I realized I was an outlaw. I'd actually broken some laws here. And that transgression in itself was actually really exciting. And which is why when I went back on the laptop the following day, that's the material I started looking for. So recognizing that there are kind of complex pathways into these behaviors, which are not just about pedophilia, but about actually having a sexual interest in children in a particular context. Several years ago, we started working with Google. If you put words into Google that suggest in your search you're looking for child sexual abuse material, a warning page like this will come up. And that warning page basically says, looks like you're looking for illegal material involving children. If you want to report an image you found, then you can do it to the Internet Watch Foundation. If you're worried about your online behavior, do you know about Stop It Now? Provided by the Lucy Faithfull Foundation. Back in 2020, we were approached by what was then MindGeek, now ALO, which is the owner of Pornhub. And they contacted us because they said, actually, we have an issue in terms of the number of people going onto our platform looking for child sexual abuse material. Can you help us with some warning pages? And we did. We introduced warning pages in 2021. And then we actually introduced a chatbot that actually would approach individuals online who were looking for illegal material. We know that they were looking for illegal material because we worked with Pornhub to put together a list of around 5,000 words that would be suggestive that people are looking for child sexual abuse material. These weren't terms like teens, they were terms like kids, 5-year-olds, 6-year-olds, things like that. And then the evaluation of our chatbot work was published just earlier this year by some colleagues from University of Tasmania. That study told us the following. For about 82% of user sessions, actually only a single warning or interaction with the chatbot was enough to stop somebody moving on to offending behavior. Now, there are some problems with the data, but just to explain what we mean by this, if you go on a pornographic website, the website deposits a cookie on your laptop. It does that even if you're on a private browser. And that means when you go back onto that website, the session you started continues. They're basically taking the data that you put into them and using that then to find more videos that look a little bit more like the ones that you looked at before. This happens with every website that you go onto. And in fact, actually, one session will continue every time you go back onto that pornographic website until either you clear your cookies or your cookies are automatically deleted, which usually happens after 180 days. We got an immense amount of data from Pornhub and all of this, which sometimes was over 180 days, looking at people going back and whether they used problematic search terms again. The majority of individuals didn't. That's the important thing. That actually just having something coming up online that says, actually what you're doing is illegal, was enough to nudge people in other directions. They may have gone on other websites. Hold on to that fact. I'm going to come back to that issue in a second, that issue of displacement. A small number of individuals did continue looking for illegal material, but the majority didn't. They moved away from it. Now, why might that be? Now, the important thing here is that I think we have a confirmatory bias in our thinking about sexual offending, because most of what we know about sexual offending comes from us seeing those media stories every day where we see the most serious offences being described, quite rightly by the press, and therefore we all have a mental template of the people who commit offences as being paedophilic serial offenders. Now, those people exist, but actually we need, for prevention purposes, to think about how people move into offending. And for everyone who's committed a sexual offence against children, there was a time where they had not committed an offence. And they made that transition, that shift. And here's my argument. All the data that we have would suggest that for a large number of individuals, actually it's an exploratory and opportunistic shift that takes place. And if we can get the right kinds of messaging to individuals at the right moment, we will be able to deter and disrupt some individuals. Now, why am I telling you all this about online harm? Because you're probably thinking, what bearing does that have on abuse in church settings? I'm talking about this because I think it gives us a little bit of theory that we can use quite effectively in this space. So the theory that I want to talk about is called situational crime prevention. And there are two really kind of key ideas that sit behind situational crime prevention. One is that for a crime to take place, you need an offender and you need a victim or a kind of target for the crime, if it's a property crime, for instance. But actually, the crime takes place in a specific time and a specific place. And sometimes time and place is a better predictor of crime and maybe a better target for prevention than individuals. Now, the police have known this for many years, which it's why, for instance, when on a Friday or a Saturday night, nightclubs often don't all have closing times at the same time. They have different closing times, so you don't have lots of people coming out at the same point. And indeed, when there are lots of people coming out from nightclubs, often there will be some kind of police presence there as well. Because actually, the police have identified a particular pinch point in all of this. It's why, for instance, what's called target handling, if you have car crime in a particular car park, what will generally happen is improved lighting, use of CCTV cameras and so forth, that will do things to kind of reduce risk in that particular space. And the other thing that kind of sits with situational crime prevention are these 5 principles that actually we can better prevent crime by increasing the effort needed for it to take place, increasing the risk of it being detected if it was to occur, controlling triggers for those who are likely to commit an offence, reducing permissibility of offending, and removing excuses. Now, all of this doesn't mean that we're no longer thinking about perpetrators and victims, but it does mean that we're thinking more about situational and organizational context of where harm takes place. Over the last 15, 20 years, there has been quite a lot of interest in the application of these principles to prevention of child sexual abuse. And that's precisely what we did with that piece of work with Pornhub. That we use these principles about actually how do we make sure that we're increasing the effort for individuals to find illegal material, we're increasing the risk of them being detected, we're reducing the rewards for them in all of this, and we're removing any excuses by pointing out that actually what you're looking for is illegal. So we just use these principles as robustly as we possibly can. We also have used these principles in some work with a range of different organizations now. My colleague Sheila Ritchie is with me today, and Sheila headed up some work that we did in libraries in Edinburgh. And that work involved training library managers, training them through talking about how sexual abuse takes place in organizational settings and how it takes place in public settings. And then getting those managers to do some scenario planning, thinking about actually what might happen in my library environment in the future and what can we do about that. So we ran that training, and basically, in a nutshell, library managers started to doing things differently. So in one library, the library manager said, actually, we have a children's reading area, and then we have an area where all the librarians sit, and we have some bookshelves that mean that we don't have a sight line to the children's reading area. So let's move those bookshelves. Think about that in terms of situational prevention, that it's about actually making crime more observable if it was to take place. In some other libraries, library managers said, actually, we've never actually put out any messaging or any posters saying that libraries need to be safe places for everyone. And if you see any of the following things, go and speak to a librarian about it. In another library, which was a blended building, which had local authority building, which had both library and social work services together in the same building, sex offender treatment took place one afternoon of the week, which meant that a number of people who were registered sex offenders would be sitting just next to the library, just at the time where schools come out and where children come into the library. So the library managers thought, actually, we hadn't really thought about this very much, but that's a pinch point. So let's do something about that. And let's find a different kind of waiting area for individuals who are registered sex offenders. So you can see by actually just helping people think a little bit about what might be the risks in their setting, that they can begin to change both the environment and the organizational culture that actually makes it more difficult for abuse to take place. And that is really congruent, I think, with this, which is an idea that's been around since the mid-1980s, developed by a sociologist called David Finkelhauer. David argued back then, and this is, I think, a kind of key kind of concept in the sex offending literature, that for sexual abuse of a child to take place, there are 4 preconditions. One of those is a motivation, wanting to do something sexual with a child. Although I think it's probably worthwhile saying that since David wrote this particular model, our understanding of motivation is more complicated. Going back to that thing about, we probably used to just think that these were people who are paedophilic. I think we have a more nuanced understanding that actually it's people who have a capacity to be sexually interested in children or a child in a particular context. Quite often we'll have individuals who will say to us after they've committed an offence, I don't have a sexual interest in all children. I just have a sexual interest in this particular child. I don't know where that came from, but it seemed to happen for me. There needs to be motivation. There need to be some kind of drivers in all of this, which, to be honest, are often around individuals' kind of mental health issues. But then there are internal inhibitors that need to be offset in some way. Internal inhibitors are the voice in the head that is a moral voice. That voice that says, actually, if you did anything with this, that would be wrong. Now, what people who commit offences are quite good at is finding ways of bypassing that, finding ways of justifying their thinking to themselves. Going back to situational crime prevention, you can see why the stuff about reducing excuses then becomes really quite kind of critical in all of this. You know, what kind of messages socially do we provide that actually kind of mitigate some of those kind of distortions that offenders develop over time? External constraints, you know, for contact abuse to take place, the offender needs to create opportunities where they can have secrecy with the child. And then eventually they need to overcome the resistance of the victim in all of this as well. But you can see how those things around overcoming the resistance and indeed the external inhibitors are really about, once again, kind of creating environments where there's an element of transparency and openness, where things can be seen. And this then maps on to what we know about abuse in organizational settings. I wish we had better data on this, but what the data is that we have so far, and particular the work of Marcus Aruga and Stephen Smallbone and Richard Wortley in this area, is that actually those who abuse within organizational settings are often more opportunistically orientated to begin with, rather than individuals who are pedophilically orientated. It's important that we keep on having things like PVGs and disclosure checks and what have you, but you'll know yourself that actually the majority of individuals who sexually harm children would have passed a PVG check. That's true of Jimmy Savile. Actually, although we need those kind of measures because they do deter some bad individuals becoming involved with organizations, we also need to recognize that actually often the people who present harm within organizations are already there within organizations. So we need to think about kind of opportunism in all of this. And we are starting to get some kind of good data which would suggest that there are precursors often to abuse taking place. And those precursors are usually about incremental boundary violation with children or vulnerable adults over a period of time. We've got some really good data that's now coming from the Center for Child Sexual Abuse Prevention at Johns Hopkins University, where they've just done a big study of abuse in scouting contexts over the last 20 years in the US. And what they're seeing is a real kind of correlation between kind of boundary violation behavior and then offending. So we know that it's difficult to, it's impossible to know who might abuse simply by looking at what people look like, but there are behaviors that we need to pay attention to.
Recognizing the warning signs in adults. People who sexually abuse children are difficult to spot in a crowd, but you can look for the warning signs in their behavior.
These warning signs are not always obvious. but there may be cause for concerns about the behaviour of an adult or young person if they, for example, refuse to allow a child enough privacy or to make their own decisions about personal matters, insist on physical affection such as kissing, hugging, wrestling or tickling, even when the child doesn't want it, are overly interested in the sexual development of a child or teenager, discuss or share sexual jokes or sexual material with a child or young person, online or offline, insist on time alone with a child with no interruptions, spend most of their spare time with children and have little interest in spending time with people of their own age, regularly offer to babysit children for free or to take children on overnight outings alone, buy children expensive gifts or give them money for no apparent reason, frequently walk in on children or teenagers in the bathroom, treat a particular child as a favourite, making them feel special compared with others in the family, or pick on a particular child. One of these signs doesn't necessarily mean the person is a sexual risk or that abuse is happening, but all should be taken seriously, and a number of these signs in combination should get our urgent attention.
I think we need to look at what the scientific evidence is about prevention. We're at that stage now where we need to really look empirically at what's going on here if we're going to make a difference. There are some studies that have looked at the views of offenders in all of this. Now, you can take those with a pinch of salt if you want, perhaps with a position about, why should we trust what offenders tell us in the first place? But I do think there is something about kind of paying attention to the voices of people who have caused harm. And in this particular study, it looked at just over 300 people who committed sexual offences, just over 200 committed offences against children. And it asked individuals to think about situations where they had abused a child or an adult, and those situations where they had wanted to abuse an adult or a child, but had not managed to achieve that. And then the researchers had a look at what were the factors around when somebody was motivated, but were then deterred in some way. And there were two things that came out in all of this. Once again, I think very congruent with situational crime prevention. One was victim resistance. A child being able to say, actually, I know what you're doing here. It's not going to happen. I'm going to go and speak to an adult. And it's not the responsibility of children themselves to stop themselves being abused, but it does remind us that actually there are things that we need to do in making sure that children know what abuse is in a way that is developmentally right for them and not upsetting for them, and that they know they can go and speak to a trusted adult if anything concerns them. But the other thing that stopped offenders overstepping a particular mark was knowing that adults would see what they were doing, or that they had been challenged in some way in relation to their interaction with a child. So once again, absolutely congruent with situational crime prevention. And then a much smaller study, but I think quite an interesting one, interviewed a small number of people who had committed offences within organisational settings, asked those offenders what policies or regulations in youth-orientated organisations would prevent child sexual abuse, and what do parents need to know to reduce the risk of sexual victimization. So bearing in mind, this is what offenders tell us. But the things that they told us was eliminate hidden areas within organizations. Don't leave children alone with adults. Well, that's not always going to be possible, of course. But there are things that we can do around kind of improving kind of safeguards there. Don't allow staff to take children home under any circumstances. Make sure that you're avoiding special relationships between adults and children. Now, I think that that's problematic because actually our job as childcare professionals or people working with children is often to build empowering special relationships, but it's making sure that actually there's the right kind of transparency and monitoring and safeguards around all of that. And in terms of the things that they wanted parents to know about, they wanted parents to talk to children about what sexuality is, what sexual abuse is, They suggested that parents need to have good relationships with their own children. So if the child was worried about anything, that they felt that going and speaking to a parent was a safe thing that they could do. So the importance of nurture and attachment and all of that. And they wanted parents themselves to understand abuse and to understand how adults who are serial offenders will often groom parents and adults as well. You know, things that offenders are telling us that very much kind of resonate with what other research is telling us. I mentioned right at the start that I think there is an issue here, which is that most research has focused on abuse perpetrated by priests, and I think that's kind of distorted the conversation. So please, accept all my caveats and apologies in putting the next few slides up here. But I think there is some interesting stuff here. So the John Jay study about sexual abuse within the Catholic Church in the United States, one of the things that it found was that those priests who had been convicted, that on average there was an 11-year gap between becoming a priest, being ordained, and the onset of alleged abuse. So going back to that thing about opportunism over a period of time, maybe something that is worth paying attention to here. And we normally think about those who commit offences in these kind of contexts as being serial offenders, because actually that's what the media has depicted quite rightly in describing the most serious cases. But actually, the research would suggest that the majority of those priests who were involved with child sexual abuse actually had only one victim. Now, one victim is clearly too many. Not being able to identify specific pathologies in relation to those priests, and indeed not being able to identify significant issues around paedophilia amongst those who had committed abuse within clerical settings. Now I'm getting close to the end before I kind of pull things together, but a few things that come from other things that have been written about abuse in faith and belief communities generally. You know, it's obviously worthwhile kind of pointing out that in any kind of faith setting, there are often huge numbers of children and teens, often involved with kind of youth work related activity, which is why there needs to be a focus on safeguarding there and indeed on prevention. We do know some stuff around kind of abuse perpetrated by clergy. As I say, I think that's been distorted in the literature, but there is stuff around the power and authority that individuals have been able to use with respect to potential victims. Grooming is typically identified as being part of the offence chain, but I would kind of caveat that a little bit by saying that generally we look at grooming through one end of the lens. So when somebody is convicted of an offence, we look at the relationship that they built with a child over a period of time. And for those who are serial offenders, I think actually that building of that relationship in a way to be able to abuse a child does definitely happen. But for those individuals who are moving into offending behaviour in the first place, I think sometimes, apologies if this feels controversial, but sometimes the things that we see as grooming are sometimes actually the building of a relationship with a child for positive reasons, and then in the offender's mind it becomes sexualized over a period of time. And therefore we sometimes look back and see everything as being grooming, whereas sometimes actually there was evidence of positive relationship building with a child over time. Use of religious authority has come out in a number of different studies. Some stuff about religious doctrine being a challenge here. I would contextualize that by saying that some of the things that are there in some studies, we should maybe turn on their heads and think about how religious doctrine can be seen as a positive thing as well. The confessional, for instance. Actually, I think the confessional might be a space where quite informed discussion around abuse prevention might take place within a theological context. So rather than seeing this as something that is always problematic, how do we frame this as something potentially more constructive as well? But also, it's worthwhile saying that I think often the difficulty is about putting uncertainty into practice in safeguarding contexts, meaning that people will often say to themselves, yeah, but what if I was wrong in calling something out as abuse? And indeed, I think one of the messages that kind of comes out from research in this space is we perhaps should be thinking about, yeah, but what if I was right? Maybe that's a better kind of perspective to take. And some of this is brought out by Mary Keenan's book, which involved interviews with priests who had sexually abused, kind of recognizing that, and I won't go into this a lot of depth, Mary's argument in interviewing priests who had sexually abused was that there were kind of issues in relation to kind of power and hierarchy that she identified in her work that really need to be addressed if we're going to get prevention right in some way. If you really want to get stuck into the subject in this particular organizational context, I would wholeheartedly kind of recommend this particular book. Karen Terry, who's been involved with the John Jay study in the US, once again focusing on clerical abuse. But this is some of the ideas that she had about the use of situational crime prevention in Catholic Church contexts. So you can see, the kind of principles we talked about: increasing effort, increasing risk, controlling prompts, reducing permissibility. And you can see some of the ideas that she had here, which I think need to be opened out as being not just about priests, but screening, reducing opportunities for being alone with children, or making sure that we have the right safeguards when that takes place and the right level of transparency, education about protective strategies for children themselves, reducing facilitators of abuse, educating parents, priests, and parishioners, increasing stuff around formal observation, providing information through easily accessible signs and pamphlets to all parishioners, employees about what to do if they see anything of any concern, avoiding intimate activities with minors, establishing times for priest-minor interactions, implementing dress codes for minors, and so forth. This is the call to action. If we're generally going to move away from safeguarding just being about identifying harm, and if we keep on doing that, it's like leaving our ambulances at the bottom of the cliff and waiting for people to jump off. We need to get better at stopping abuse before it happens. I'm wondering about these kind of things, whether some of these might be useful for you guys in your role in some way, including stuff around child sexual abuse prevention in training and inputs for all safeguarders. Active promotion of prevention, and indeed things like the Stop It Now helpline in parishes, having critical organizational leaders championing this issue, discussing situational factors in the course of seminary formation, undertaking environmental scans with respect to all church and religious buildings. So once again, that thing about thinking about, are there particular spaces where it's more likely abuse would take place? Implementing low-level concern policies across all church settings. So it being absolutely fine for adults to have time on their own with children, but that there being some kind of record in relation to that, but when that's happened and why that's happened, in what context. Reducing vulnerability of children through age-appropriate abuse prevention, implementing bystander preventions within parishes, so members of congregations know what are signs and indicators of concern and what they can do about that. Improve pastoral support for clergy, recognizing that actually the shift towards sexual offending usually takes place in the context of mental health difficulties for individuals, protecting and rewarding whistleblowing, and hardwiring learning from adult survivors about child sexual abuse prevention into everything we do. I think faith, belief, can really drive child sexual abuse prevention. I think everyone in this room here is committed to better safety of children, better protection of children from harm. And my offer is that our organization can provide some of the technical support from what we know from working with people who have committed offences. We would be delighted to work with any of you as individual safeguarding leads, any of you in any parishes across Scotland, to see what we can do to better safeguard and prevent harm for children and vulnerable adults. So we would welcome any kind of conversations that follow on from this event today. My details are here There's also a leaflet about us in your packs. We would be delighted to kind of keep this conversation going. Thank you.